Now to President Obama's last stand on health care. He's laid out a bill and demanded an up or down vote on health reform in the next few weeks. But how can he get that all done? And will he convince enough Democrats to make that difficult vote? We're joined now by two pivotal players in this battle: the president's top advisor on health care, Secretary of Health and Human Services Kathleen Sebelius, and the Democrat who made the difference when the House passed health care last fall, but is now threatening a mutiny over the issue of abortion, Congressman Bart Stupak of Michigan. And Congressman Stupak, you're up next, but let's start with the Secretary. Madam Secretary, the high degree of difficulty here. How can the president convince Democrats who voted against the bill last fall to vote for it now?
Well, I think, George, the president is talking about Congress moving ahead on bills that have already passed not only the House with a majority, but the Senate with a supermajority. And I think the American public deserve an up or down vote, and he's hopeful that Congress will get to work and finish the job on health reform.
That's right, but you've got a real practical problem. Congressman Bart Stupak, who is coming up next, he voted for the House bill last fall, but he now says that he and 11 other Democrats cannot vote for the president's bill unless it includes language like what was in the House bill that prohibits public funding for abortion. Is he going to get what he wants?
Well, I think the president has made it clear from the outset, George, that the health reform bill should not change the status quo on abortion policy in America. That's not what this is about. This is about the urgency of families and business owners who are facing jaw-dropping increases in their premiums, and it's why I'm bringing in executives from insurance companies today to talk about what's going on. We have a problem here with people facing being priced out of the insurance market. They're terrified about what happens next, and that's why we need to move ahead. But this will not change the status quo on the policy of abortion. There will be no federal funding for abortions.
Well, as you know, Congressman Stupak simply disagrees. He says the Senate bill does do that, and the president's proposal does do that, and unless it's changed, he and 11 other Democrats will not vote for it. So can you reach a new compromise?
Well, I hope that when the bill is in its final form and people have a chance to look at it, I think they'll understand that this bill does not change the status quo on abortion. That's what the president has pledged all along. This isn't about an abortion debate. It's about health reform.
Okay, Madam Secretary, thanks very much for your time this morning.
Sure. Good to talk to you.
Let's bring in Congressman Stupak now. And Congressman, you heard Secretary Sebelius there. She said the president's bill, the president's proposal doesn't change the status quo on abortion, does not have federal funding on abortion. Do you agree, and can you vote for it?
Well, no one has seen the president's bill yet. We've seen proposals. The president indicated yesterday 4 more proposals he'd like to incorporate. So we want to see the bill. But the bill that they're using as the vehicle is the Senate bill. And if you go to page 2069 through page 2078, you will find in there the federal government would directly subsidize abortions, plus every enrollee in the Office of Personnel Management plan. Every enrollee has to pay a minimum of $1 per month towards reproductive rights, which includes abortions.
So if the president doesn't change the Senate bill, you can't vote for it?
Well, no, we're not going to vote for this bill with that kind of language in there. The president says no federal funding for abortion. I have 8 pieces of legislation we currently have in federal law that says no public funding for abortion. Take any one of these 8, insert the language, and we'll be happy, and we can support this legislation. We voted for health care before. I want to see health care pass. I agree with the Secretary. People are being priced out of the market. We must have health care. But boy, there's some principles and beliefs that some of us are not going to pass.
But Congressman, how can you do that? As I understand the process, that kind of abortion language cannot be tied to the reconciliation bill. It would be knocked out of the reconciliation bill, so there's no way to change the Senate bill.
Well, I disagree with you there, George. We did welfare reform under reconciliation when President Clinton was in. SCHIP, the State Children's Health Initiative program, was passed through reconciliation. You can do it. If there's a will, there's a way. That's just an excuse they're giving. Look, give us our language. Let's keep current law. No public funding for abortion. Let's pass health care. Affordable, quality health care for all Americans. That's what I want to see done.
Have you asked the president to put your language in the bill?
We have repeatedly told his staff, here's what we need. Yes, I had this discussion with the president back in September before we had our amendment on the House floor. You know, it's there in current law. Why they keep saying they want to maintain current law? take their choice. There's 8 programs out there. Let's
But
just keep the language.
Let me be clear here. If the president doesn't change the language, if your language is not accepted, you and your 11 colleagues who voted yes the last time will vote no this time. Does that mean you're prepared to take responsibility for bringing down this whole bill?
Yes, we're prepared to take responsibility. I mean, I've been catching it ever since last fall. I mean, let's face it, I want to see health care. Yeah, but we're not going to bypass some principles and belief that we feel strongly about. And the president, he's showing flexibility. He's putting in Republican proposals. Look, let's keep current law, no public funding for abortion. Let's pass health care.
And if he accepts your abortion language quickly, will you vote for the bill?
We'll read it. We'll make sure it's a quality piece of legislation. Members are not interested in voting for that Senate bill, that's for sure.
Okay, Congressman Stupak, thanks very much for your time this morning.